broadcasting around the world. You're listening to the Mic Drop Club, hosted by Douglas Hamandishe. Message received. You do not need to know what you need. Just engage with the podcast feed. Providing weekly insights into cool stuff we've read, saw, did, or heard about what made us say, wow, eureka, damn, nothing is off limits. If it motivates and inspires you to reach your goals, then it shall be discussed. Featuring guest interviews from high performers and people of influence, and weekly awards for the best mic drop moment. This podcast is guaranteed to leave you pumped up for the week ahead. Don't just live life. Make life boom.
How you guys doing out there? It's Douglas Hamandishe for another episode of the Mic Drop Club. Today, as I always say in my intro, today is very special because I have a good friend, a good colleague of mine by the name of Nicolas Kelly. This is somebody that's extremely passionate when it comes to care within the health and social care industry, and care in general for our own health and well-being. So he's done some fantastic work, and somebody that is a real go-to person when it comes to understanding all the nuances that take place in caring for somebody within an inpatient environment and out in the community, or whichever way you want to slice and dice that scenario, okay? But Nicolas also is a driven, passionate individual. And so I managed to persuade him to get on the show so he can sprinkle some words of wisdom, like how he got into the work he's in, what drives him, what inspires him, and basically to just wax lyrical for however long as he wishes to wax lyrical for. So with no further ado, Nicolas, how are you doing?
I'm good, Douglas. I'm good. Thanks very much for inviting me on. That was an interesting intro. I love your intro.
No, thank you. Thank you. No, you have a very varied and very energizing background. When you read somebody's LinkedIn profile and you know them individually, there's so much stuff that you have done, you know, which goes over and beyond the norm. So on the Mic Drop Club, we really are passionate about sharing insights from people who are dynamic, people who are mavericks, people who are willing to push the envelope forward and don't really accept the station that they're in, the current role they're in. They have that expansive mindset. And you, Nicolas, are certainly somebody that fits that criteria. So a bit of background, Nicolas, how did you get into the whole social care environment?
Do you know what? I think there's two routes that kind of got me into social care, but predominantly it was my mother. So my mother started working in social care when she was 19. She worked in a care home in West London, and moved from working from a care home, then worked for the council, and then worked for a small provider, which then became the largest provider of care in the UK at that time. So she worked. Can I say names?
Go ahead.
She worked. Sorry?
Yeah, go ahead.
So she worked for Goldsborough, who were part of the Bupa group. So she was an old school person working in care. And I think my mum has a massive passion, which has always been instilled in me. And she gets up at 7 o'clock in the morning. She's in the office at 7 o'clock. She works until 10, 11 o'clock at night. And even now, working together, she still goes out and does care work because inevitably she has service users that she's had for the last 15 years that only want her to look after them. So she still looks after them on that basis. So that kind of was the initial exposure to care, and realizing that actually there is this industry that people are doing that actually you have to have a passion and love to do it. And I kind of we set up Respect Care, which is our first care agency around 13, 14 years ago now. Actually next week's our anniversary, 14 years.
Done. Well done.
Yeah, which is strange. So we set it up. It was us. We set it up in West London. It was a very small office. The office was probably about the size, smaller than a box room. I remember the first day we set up. We had the computer that we had to turn on, and the computer took I don't know an hour to turn on. Couldn't load up. Couldn't turn it off because it wouldn't load up. And we basically had a note on the door that says, "Do you want to sign up for care work?" And we thought, well, this is going to be a waste of time. And I think we set up at 9 o'clock in the morning and no one turned up until about 9 o'clock. No one turned up, 10, 11, no one turned up. And we were sitting there going, well, this is a waste of time. and actually, we'd also just set up the whole company yesterday. So it was a massive worry that, you know, we've now put all our energy into this one thing and how are we going to make it grow? Yeah. And then 7 people came in. Seven people walked in and said, one of them walked in and thought it was something else. But everyone else that walked in said, look, it'd be great to kind of understand a little bit more. We signed them up, we put them through the process. And we still have those 7 people. Those are our 7 care workers, 15 years in, still doing care work for us. And we'll leave, won't go anywhere. And I think I can kind of give you a little bit, I'll give you a little bit more in a bit about the reason why I think people stay with us for that long. But 7 years in to still have the same staff. I don't know most offices that still have the same staff 7 years in the same company. So that was amazing. So we set it up, and we got one or two clients. And I mean, as you know, in social care, when you kind of run the care agencies, you can't register with CQC because you need recommendations. So you basically have to go off and do a whole lot of things before you can get someone to recommend references to be able to do care work. So you can't just set it up straight off the back like that and get it running. There's a whole lot of rigor that you've got to go through. So we spent a good part of 6-7 months trying to get clients on board. We were doing cleaning work. We were doing other things that weren't involved in personal care. We did everything we could to try and get those references in place. We couldn't work with the councils because councils wouldn't touch you unless you were registered and had your rating. So it took a lot.
That's a challenge.
And in that time, sorry, go ahead.
Yeah, and that's a challenge right there in terms of getting that referenceability. You see that a lot with established companies that want to enter a new market and have no referenceability. It's a real big issue. And I guess they get around it by, you can acquire customers. You can literally buy customers depending on what industry you're in. But social care is one of those ones you can't do that. So
no, and I think what you can see is a lot of new age, these kind of new challenger companies coming in. What they're doing is they've gone down the route. There's a lot of them that you can look in any newspaper that have got, we've got £7-8 million backing from 6, 7, 10 investors. We're going to change the way that social care works. And you see, they all go in and they try it. And the first thing they go is, we need to get a CQC rating. Okay, we need customers. We can't do personal care because that's illegal. But we're saying we want to do personal care. Okay, we're going to have to buy a care agency. And you notice that a lot of these ones, there's 2 or 3 that you can even see that have gone off and said we're going to be completely online. We're going to be completely digital. Have now started going off and buying brick and mortar care agencies because they realize that actually the online just doesn't work enough. You need a brick and mortar. You need an established care agency because you need to get that rating because no one's going to touch you or work with you unless you've got a good or outstanding from CQC. And the only way you're going to get that is by having that already in place. Okay. So, when coming into the industry is ridiculously hard. And I think there are so many barriers in place. And I understand why those barriers are in place to protect people. But also I think that the barrier is also in place that you have to have the financial backing. Sure. So, another example is you can't go for most contracts you can't go for. Nowadays it's changed, but I remember a contract we were looking at one point from Westminster City Council, and you had to have nearly £7 million in the bank. You had to have £7 million in the bank and an annual turnover over 10 million to be able to apply for the contract.
Sure. So
straight away you removed every last person that wasn't one of the sort of your big 3 or 4 at that time. And now, but what you've got is those big 3 or 4. There are the way that they're looking at the care is they're looking at care as a business. They're not looking at care as an individual. And I think the smaller, medium-sized care agencies are going, well, this person is very important to me. I need to do the best for this person because this is my livelihood. And when you look at that, every last person as that, not as a whole of, okay, we've got 20,000 people we're looking after. Great. We'll just make sure that all our forms are in place. When you look at each person as an individual, each person as a person, you're trying to deliver the best level of care to every last person. And in turn, the whole business succeeds and the whole business will flourish. But when all you're doing is looking at it as a number on a balance sheet, it's very, very hard to deliver very person-centered care. And you can see how that's why CQC have changed the way that they look at it. So I kind of jumped ahead. So yeah, I kind of did that, and then I left. So I set up Respect Care with my mom, and then I kind of needed. It was growing, but it wasn't growing in any way quick enough or doing what it needed to do. So I kind of went back into industry. So it was still churning around in the background, it was still doing a lot, but I was able to kind of go off back into the industry and do freelancing. So I freelanced at Unilever for, I think it was 3 or 4 years, doing API integrations, building apps, building digital solutions. I think the current Unilever website, which is 120 plus country websites, was there. I helped with some of the mergers of products. Left Unilever and went to a small media agency. Went up to to the likes of AKQA and LBI, and then I got headhunted for Apple, which was amazing. Which was an amazing opportunity. Which was super cloak and dagger. Which I didn't realize I was interviewing for them until I think it was 3 interviews in before I realized who had actually interviewed.
Wow, you had 3 interviews.
Yeah.
Was that based in the UK offices as well, the London offices?
It was based in the UK office, but it wasn't until the 3rd interview that I was told who I was interviewing for. So I got a call from a recruiter, and I love getting calls from recruiters, so I normally just ignore and hang up the phone. Mm-hmm. But I got a call from a recruiter saying, look, someone would like me to approach you for a job. They've heard about you, some of the work you've done. Can you come in? I'm like, I don't know who you are. I don't know what. Can you tell me who the client is? No, sorry, I can't tell you the client. I'm on the NDA. Yeah. I'm like, well, you asked me to come in and apply for a job for something you can't tell me who it is. And it's like, well, no, I can't. Like, okay, fine, I'll go in anyway. Did the first interview and still didn't get told what was going on. Then I did a sort of a meeting in a cafe, which was quite an informal, and coffee, and they were just generally asking about work I've done and kind of what my understanding of the industry is and how I think the future of technology could go. And then the 3rd interview, I went to a 3rd interview, completely generic building, until I walked through the elevators on the actual floor and I saw the logo behind the desk, and I was like, it's all clicked.
Yeah.
It's all clicked.
So how were you feeling at that point when you suddenly glance and you see the logo? What's going through your head and how are you feeling emotionally?
I had butterflies. Yeah. There's only a few things that's ever made me really have butterflies in this world, and that was, I think that was the second time I've ever had it. The first time was the day that I was allowed to fly an RAF jet on my own, and I was like, wow,
that's something that we need to cover on this conversation.
Yeah. But I was like, you're going to let me fly this thing?
Wow.
But then when I looked at the Apple logo, I was like, oh wow,
yeah,
I need to not mess this bit up, because if I've got this far, I've done pretty well. And I remember kind of walking in, and there was sort of 3 people on a panel, and it felt quite informal, and actually. This is sort of things that I've now taken. So all these things I've learned from you, Unilever and Apple, I've taken into my business. And I think that's what's quite unique again about what we do. But the way it was so informal, it was just asking questions, just like, tell me a little bit about you. Oh, I noticed on your social media you do this and this. Can you talk a bit about this a bit more? And I was like, oh wow,
they've done their research. They've done their research.
Yeah, and it wasn't just, I've looked at your CV on a piece of paper, but it'd gone on to my LinkedIn, they'd gone on to my Facebook and my Instagram. And even, I think at one point, I think they looked at my very old MySpace account. That's how old it was.
Oh my God.
And they'd basically just done everything and gone, right, just tell us, we know who you are, but tell us how how you got to this point in your life and why you think you want to work for us.
And that's a very important, situation you're in. Very, very challenging, because I guess they've done their research. They're knowing you more than you know them at that stage. Because again, cloak and dagger, you didn't know it was Apple until you saw the logo. You enter this room, got 3 people there, and now it's a more informal situation, because now the organization that potentially wants to hire you, they're more relaxed in terms of you have gone through the filtration process. So they're more relaxed, but potentially the balance is on the other way, whereby you now are feeling more nervous, possibly more, I don't know. How does the butterflies manifest in you? How does the butterflies actually manifest in you? Sorry.
So that, well, no, you're right. I think what threw me off was this is one of the companies in the world. This is one of the 2 or 3 companies I've ever wanted to work for in the world.
Yeah.
And when you think about an interview process, so if you think about when you're going through school and you're being prepped for an interview, every interview you have in a job, you're going in suited and booted. You're going in, there's a piece of paper in front of them. They ask them 10 questions. They've got your CV, and that's how you have to perform in that. Each question by question, you have to perform as best as you can. And then they completely flip it, and it's very informal, and it's just a general chat. And that general chat is the interview. And your brain is like trying to work out, like, this isn't normal. Like, I'm expecting an interview to be this way, but all of a sudden the interview is completely different and it's this way. So how do I kind of make sure that I'm getting my answers across, but they don't feel so formulaic? So, what do you bring to the table? And you've got in your mind, you've got a very fixed answer for that. But that's not what they want. They want to know why you as an individual are going to help and support the company to grow and build on the current business model and mission of the company.
Yeah.
So it's not, I feel like I'm a go-getter, and people say that I work too hard, and that's probably one of my downfalls. No, it's like, well, actually, you know what? that's not. I like to learn about technology, so I go down rabbit holes. I will start. For example, last night I was working until 2 o'clock this morning because I started on one thing, and then I basically tried to learn how to code something. Then I popped some headphones on and learn how to do a bit of coding. And that's what they want to know. Not from the coding perspective, is how do you learn and what is your decision path to get to somewhere? They want someone that, one, can conform, but people that are free thinkers that are going to continue to keep pushing the business forward. And I think that completely threw me off. And that's something that I've now kind of adapted the way that we interview people. So in the business or interview, there's always a HR person that has formal questions. I'm normally sitting in that meeting, and I still do. We've got over 200 something staff, and I've sat in an interview for every last member of staff, because the way I want to know is I want to know if you fit into the ethos of our business. I want to know if you're going to be somebody that comes in and just does your work and go home, or if you're going to be somebody that tries to push us forward and see things that I can't see things that other people can't see, work out how we can keep growing. Because as a small family-run business, we have to keep growing, because we can't be stagnant. We can't be reactive. We have to be as proactive as we can. And I think that's, I know we're jumping around, but that's kind of why I've gone off and built the technology, is because we have to be proactive. We have to be able to be ahead of the curve and see things before other people. And we have to do a lot more with a lot less, but do the same. So yeah. Sorry, go ahead.
So how did it go? How did the interview go?
Well, I thought I completely messed it up because I think I was very nervous. I walked out and thought that was terrible. That was one of the worst interviews I've ever done. Yeah. And then I think I left the building, which is in Hanover Grand. So I left the building. I was walking towards the train station. Got on a train, and I lived in Queen's Park, so it's about 15 minutes on the train or so. And I got off the train, and I got a call saying, "Great, they'd like you to start on Monday."
Oh, well done.
And I went, "Well done." You just go, but that was. I did so bad. I was like, "No, actually, it was one of the best interviews they've had," and I was like, "Yeah, okay."
Isn't that so funny though? Isn't that so funny? Sometimes the interviews that you think you bombed, you've excelled in. I think I was reading something from a professional actor, and I was talking about embracing anxiety, embracing that state of being vulnerable as well, and also being able to maintain your innocence and the sense of who you really are within that state, because that's an endearing quality. If you are able to still communicate the essence of who you are, the fact you love technology, the value that you can actually bring the real you outside of all the structured questions that HR would have been dropping beforehand and all that kind of stuff, that is golden. And I'm always fascinated by the people stories, and it always works out that when they say, "Oh my God, that was the worst thing ever," I tell them, the general, just wait, just wait.
Yeah. And I think I could have really thought, I did think I did bad, and I could have panicked, but I think I walked out and I thought, I did the best I can.
Yeah.
And if that's my one shot, fine. I'm sure another opportunity will come around. So yeah, I went there. I was managing a team, I think, of 30 or 40 developers, which was the largest team I'd ever managed at that point. And I think a week into my role, I was flown out to California to manage the launch of, I think it was the iPhone 6 or iPhone 7, and the amount of security that they do, as I said, military security is could learn a lot from them.
Wow.
That
level of security.
I don't want to go into it, but the amount of just the sheer logistics and security behind you. You've got double doors, you've got security doors, you've got security measures, you've got email groups you can and can't do. You can't take anything out of the building. You can't take anything digital into a building, into a secure environment. You're going into rooms that are being pumped full of oxygen. So you're in a room for like 13, 14 hours a day, and you don't feel tired. You walk outside, take a breath of fresh air, and you're like, I need to have a little nap. you walk right back in, you're like, no, I'm good. Yeah, I've got another 8 hours in me.
They're controlling the atmosphere inside the building as well.
Yeah. So I was there, and then I left Apple, and then I got a role. I got hunted for a role at LinkedIn, which was sort of an API integration role. This is all one side of it. And in the background, the care agency still got in the background. So in the background, we've gone from having 1 or 2 clients to now we're providing care for nearly 2,000 people. We're doing sort of 10,000 hours, 12,000 hours of care a week. We're working across 3 or 4 London boroughs where we're growing. So I'm now having to kind of manage both of those. So I'm doing my day to day, and then I'm getting home and I'm like, I'm building robustness. I'm building an infrastructure. I'm building online stuff. I'm making sure that we've got recruitment processes in place. I'm building partnerships with people. I'm looking at how we can then do more training for the staff. So there was a lot. There's a lot being juggled on 2 plates. But again, I couldn't have done both things if it wasn't for working with, again, my mother, because she just loves care. So she's just in there day to day getting it done. And it's someone that I can fully and wholeheartedly trust that she's going to deliver on that. And it's someone that understands that industry more than I do.
Brilliant. So on that note, I think it's important that I interject with all due respect. And on this show, we like to do what we call mic drop moments and stuff like that. And we drop bombs. Yeah. So we want to give your mother, right, an atomic mic drop, okay, for all her hard work and dedication and love to the care industry, right? Because without your mother, we wouldn't be having this conversation right here. So this is for your mum.
Okay, guys, everybody ready?
Atomic mic drop.
There you have it.
She is. I'm going to take 5 minutes in a little bit and explain just some of the things that I think she does that's amazing.
Yeah. And
I think we might have another mic drop there, but she's just an amazing. So yeah, so then, I was at LinkedIn for 3.5 years, 4 years. And then I just thought, I think I was in 1 or 2 meetings that made me just think this just isn't as important as care.
Yeah.
And it sounds strange, but I was in a meeting and someone was like, we were selling like advertising, digital advertising. It's like, we're selling this, they need this, they don't have it, they're gonna die. This piece of kit is oxygen. This is gonna be the best thing in the world. This is gonna be nothing else they need in the world. And I went, no, people need care. Yeah. That's what they need. They need access to care. They don't need access to online banners. So I said, this is me done. I can't keep doing something where I don't fundamentally believe I'm making a change in the world.
Really?
And I think this was nice. It was nice to do it, to learn, but it was distracting me from something that I felt very passionate about. So then I kind of went back into the business and we started cleaning stuff up. And one of the things I realized was I had a lot of people trying to push online solutions to us or technology to us, but the technology wasn't doing anything. So, people nowadays, you go, we've got digital care notes. Okay, great. So all you've done is replace paper care notes with digital care notes. What are you doing with those digital care notes? How are you unifying the way that those notes are coming in? How do you quantify any information on them?
Exactly.
So for me, it was, we've got 10, at that point, we had 10 years worth of data that was sitting in an archive. So the first thing I did was like, okay, great. Instead of having these in folders and boxes, let's scan them. So we found a scanning company that was really amazing. We use them, we still use them now. And they scanned all of our paperwork. And then because of the way that they scan it, you can actually they create PDFs, and you can actually search the PDFs from the scans, from handwriting. So that was amazing. So now I've got 10 years worth of stuff sitting on one of our servers. So if I ever need to search for a file from 5 years ago or search for a specific service user name, so word, or something that's happened, I can just search that. But if you've got boxes, if you're still using boxes, like some doctor surgeries still do, or like some hospitals still do, what's the point? Like, if you've got to keep records for 5 years and you don't know where those records are and what actually, and you don't have, things aren't archived, then all you're doing is you're just gathering dust on pieces of paper.
Exactly.
So, and I think that's what so many people do is like, we've got to keep the records. Okay, we'll just chuck it in the cupboard because no one cares about them. But actually, there's so much valuable information in that. So what we did is we built two systems. We built our HR system, and we built our Care ID system. The HR system was a fundamental ask because in the care industry, you've got to make sure you're on top of training. You're making sure you're on top of supervision, spot checks. You've got to make sure you're on top of visas. You've got to make sure that you're on top of documentation, DBSs, work permits, the whole lot. There's so many, there's 7 or 8 different things that you have to stay on top of that could at any point, one, have HMRC come down and you, have border control, have CQC, all these people. If you can reduce that stress, that's just something that's done. And actually what you've got is, if you've got a staff member from 5 years ago, you put them in a cupboard, but if you've only got a couple of staff, that's fine. But when you've got 5 or 6, and I came back and we had 10 filing cabinets with all our staff information in them. What happens if you can't access those filing cabinets? What happens if you miss something in there? What if you miss a piece of document that needs to be updated? So we created the HR system. And what the HR system did was it took all the information, we put it online. We created a very simple rules-based engine. So the system basically went through and looked at what care somebody was doing alongside what training they had, and flagged up if they were lacking a specific training. It also flagged up when someone's DBS was coming up, when someone's visa was coming up, and even flagged up when someone's birthday, because actually we as a company, we champion people's birthdays. So every last member of staff gets half a day off for their birthday. Everyone in the office gets they get a present, they get a card, the whole lot. And they get a few other bits, but that's what we do. But we wanted to make sure that we had a system in place that did that. We then looked at all of our care information, was like, so we've got all this stuff on paper, we're signing it off. But if you're only signing off a week or a month at a time, and you're looking after somebody over maybe 6-7 months, you might miss very simple changes because all you're doing is looking at information in isolation. You're not looking at the longevity of it. And you might have maybe 2 or 3 different people that might look at that document and sign it off. So I might look at it and go, okay, great. Her mood's down a little bit. She's not eating a huge amount. Okay, great. I'll second go, can we just check on that? That changes in the next person. Next person goes, oh no, it's all great. 3 months later, it drops again. But because you're not seeing those peaks and troughs, and all you're doing is looking at each book or each week or each month as isolation, you can't see any patterns. Okay. So with the Care ID system, it starts to look at patterns in person's behavior. So it's looking at what that person's eating, it's recording their mood, it's recording the care notes, it's recording, and now we've got integration with wearables. So we're also taking into account your vital data. And how do we take all that information, analyze that information, and then inform the person delivering care or providing that care on what's going on? How do we provide enough information on their service at a service level to say, all right now you have had an increase in service users that have, dementia. You only have 20% of your staff that are trained specifically in that. to kind of plan forward, why don't you train an additional 20 staff? Because we think this is what's going on and what we can see from an industry perspective.
Sure. And I think just so I can start to frame it for some of the listeners out there who do not come from that industry, it is very important to understand that care does not exist in a point in time scenario. For example, if you just have your blood pressure taken, okay, that information that you're receiving in terms of the value is important. But what's more important is how does that relate to other activities and how does it relate to your blood pressure throughout the day? This is why monitoring is so important. So what I think you're framing there is the fact that now you got this data that's now relational. So you can make greater insights of the information of the actual care episode. So you can use that for further learning, tweaking, investigations, ensuring best practice, all of those things, whereby if you just had data, just sitting compartmentalized data, you cannot make those relationships. And I think that is what is the richness. And I think your background is helping a lot in that. The fact that you have this coding, IT, not IT is too broad.
Technology.
Yeah. You got this technology background and you're bringing it to bear within a caring environment, which makes your company very, very unique to get that richness framed around and embodied by your mother's core values that brought you into that. Because I guess my mom was, just to digress quickly, and support what you're saying, my mother was a matron as well, nurse. My background was mechanical, electrical engineering, mechatronics. But because I used to drive my mom to work all the time, she'd tell me all these stories. Some of her values, some of her principles, and the challenges that she was facing, I wanted to help. That's how I got into the same space. And I think that's where we mirror each other, that our mothers, we watched our mothers and we followed that and we brought skills from a different sector to bear in that environment to make sure that you can deliver better, smarter care. So no, I totally salute you there in terms of the building, the rationale behind the 2 HR system, which is very, very important, and the Care ID. So which one do you lead with? Which one's now taking up more of your time?
Care ID. Care ID is so what we've done is we've now incorporated the HR into Care ID. So it's one hybrid system. I think the benefits of having one place, and again, I think one of the big problems you have in health and social care is information sharing, because inevitably information rarely passes backwards. So we really see information coming back from someone once they've been admitted into hospital. We actually, in most cases, only now in certain instances, but you rarely ever see a discharge note from a hospital back to a care agency. You just know that person's been discharged. You don't know what they've had on the ward. You don't know what information's happened, what's happened to them. So you don't know how their care has been changed and what you're adjusting. You've just been told, right, you now need to go in and do these 3 things. And you go, but they need maybe a bit more than that. Well, we can't, we'll see. But when you because we've got sort of the business is split into 2. So we've got social services and private clients. Private clients get a lot of that information. So we can work a lot better with them, which means we can build systems that work very, very well for them and then pull that across and say, okay, this is what else we're doing. This is how we think we can benefit those in the social care side of it. Yeah. And I think that uniquely is not the right word, but I definitely know that we are definitely one of the only agencies that have started to build our own in-house tech and building our own in-house tech ourselves. So, and that's kind of where I think my background has led is we went out and we didn't try to build a HR system because there wasn't a HR system out there. I don't want anyone to believe, they just went off and built one because they couldn't find one. No, we were trying to find a HR system at that point, sort of 3 years ago, that allowed us to track DBSs, track visas, track passports, track eligibility to work, and also track holidays, and also hold any symptoms and medical conditions office staff had, so we would be able to support them if something went wrong. there was no system out there that did that. The closest system we found was an American system that was built in America that we spoke to them and they said, yeah, we're happy to customize it. That was going to work out as something like £30,000 a month. And I just went, there's no way I'm going to spend best part of 300 grand a year to have a system. I might as well just go off and build my own.
Build it, yeah.
And that's what we did. We sat down, myself and my operations director, we sat down and we said, okay, what do we want it to do? And that was it. Fundamentally, what do we want it to do? And how do we think we're going to save someone's time? Because what we don't want to do is replicate paper, which is what a lot of other systems do. And we don't want to create a whole lot more work for somebody. And we said, okay, so we stripped it back and we did a Moscow rules, and we looked at how we can do this in sprints. And I think we built the whole system in about less than 6 months, and it cost us less than 20 grand.
No, and
it's been, it's still been used 2-3 years in, to an extent. We've had CQC and then CQC looked at it. We've had Home Office in to look at it, and they've looked at it. It's a robust enough system. It's secure. And that I think that's where we took that. Whereas if I'd have gone off to somebody and said, okay, can you spec this out? I know for sure, because we then gave the exact same spec to an agency, and the agency came back and went, it's probably going to be 500 to 700K, and you're probably looking at about a year or two, 18 months, I think is probably the time frame we think we can have this. We definitely think we can give you something. And we went, it's okay, thank you. We just wanted a gauge to make sure we were on the right lines. And then again, when we were trying to work out what to do with Care ID, there was, at that point, there's some great companies out there. There's the likes of Pass System, but what they were trying to do for us at that point was just replicating something. They were replicating paper notes and not doing anything more with it. What we wanted to do was make that process really, really simple for somebody inputting the information. But we wanted to take that data, analyze that data, and let the data inform better care decisions. So we've got someone that works on the AI side, and they built a piece of AI that artificial intelligence or machine learning is probably the better word. Because it's not pure AI, but machine learning, which it's built in 3 layers, where it's trying to learn information. It sees information going into the system and tries to infer what's going on. It tries to find things that are missing and go, okay, last time I saw someone that had that mood, was missing that medication and wasn't eating, this is what happened. So I think this is potentially what's happened to this person. So it flags up that it thinks there is a correlation and an issue, and it gives you what it thinks it might be. It's not telling you it is that.
Yeah. It's helping to inform.
It's helping to inform the information. And what we then said is, okay, the only way we can look at that is because as a care agency, you're only seeing that snapshot. And everyone that looks after you only sees a snapshot. So your doctor only sees a snapshot. Your doctor doesn't see your care notes in the community. Your doctor doesn't realistically, in some cases, doesn't even see your hospital notes. They don't see other information. Everyone's looking at you as a snapshot. So you said, okay, why don't we build a system to be the longevity of that individual's health? So no matter where you go, everyone is feeding into that one system. So the hospital system is pulling into it and showing that data. Your doctor's system is pulling into the one place. Your care notes and your care information is pulling into one place. Wearable information is pulling into one place. You as an individual is also inputting into that and being a part of that journey. So now you've got one unified place where all information is. It doesn't matter if the information is noise, it doesn't matter if the information is pointless. It's one unified place where information lives, where you can then start looking at what a correlation, because you might go, you had a curry. Okay, fine. And then you then go, I've got indigestion. You go, you got heartburn. No, I don't really care about that. But you might go, well, actually, no, that heartburn isn't heartburn. Actually, it's you've got an ulcer because you're eating spicy food because it's got turmeric in it and you're allergic to turmeric. Did you know that? And all of a sudden you can be like, now all of a sudden, because you're looking at the whole thing. But if not, you're going and you go, you kind of go, okay, I've got heartburns. I'm using a minor case and actually probably use a better example. But you're looking at these things in such isolation. By the time you go see a medical person, a doctor, or whatever, that thing stopped. And they can't check for that.
Exactly. It's powerful, and it enables you without going into technical stuff, it enables a clinician or care professional to be like Columbo. be able to ask that, Columbo, just one more question and see the connections and join the dots, whereby before, again, it'll be sparse data, siloed, that doesn't fit into a bigger picture. But because now you can make the connection, the AI is helping spot trends, you can be proactive, which is something that I'm a big fan of in terms of health tech, bringing solutions that enable clinicians, care professionals to make informed decisions at the point of care. And again, I have to big you up, Nicolas, because not only have you built something, you built something in a timely way that is fit for purpose. Your use case was narrow in the scope of you looking at it from your own company's perspective in terms of what the agency required, but it's one that is expansive because you managed to hit your marks on everything that you built the system for. And too often we end up having to bid for, within health particularly, we end up having to bid for solutions that don't actually fit the use case completely. And therein lies a lot of waste within the NHS. So there's so many software pieces, or so much software and hardware that sits idle because it's never really fit for purpose. And this is where I salute companies such as yourself for being bold enough and having the knowledge and the passion to bring forward something into the market that is actually adding value in there. So just in terms of, I want to get also the listeners to understand you, the mind that drives you. What's driving you and what's compelling you to push forward into this space?
Do you know what? I think I think what's driving me is, and I went through a lot of hospital time throughout my life. You know, I think when I was 9, I was run over and I spent sort of 6, 7, 8 months, and it was probably 8 months, I think it was, in hospital, getting multiple injections. And I've had a bike crash which ended my career, and that took out. I've had 6 or 7 surgeries on my knee to remove bone fragments, to remove cartilage, to shave the knee, to repair torn ligaments. And I think the one thing I that really has frustrated me is each time I interact with a doctor, they ask me when I had my operation. They ask me when that was. I don't know. I genuinely still to this day can tell you when it was. Like, if I look at a map on a calendar, I can say, yeah, I think it was when I was 19 and it was this date. But the information sits in front of you. And it feels like our health and social care system is so disjointed, and everyone keeps talking about it as our health and social care. It should just be care.
Exactly.
It's our care system. It should be unified, one sole place where I have an investment in my health, you have an investment in my health, and we're all working together to be proactive in my health, not reactive.
Exactly.
Not just prescribing medication. And I'm kind of getting to and this might be quite controversial, but I'm getting to the point where I think the old idea of the doctor knows best and the doctor is the only person that knows about my health isn't right. I'm the one that knows more about my health than the doctor.
Yep.
The doctor knows from a medical perspective what might be going on, but I know what's going on. I know what's changing. And I think individuals and people need to know about themselves and their bodies to be able to articulate that to somebody else.
Sure.
And you have to understand what that changes. So even the smallest change you don't think could be something, you need to explain that, because that could be something that's going on.
Exactly. That's the whole empowerment movement, whereby for years, I think the medical model has been focused around treatment. As you quite clearly articulated, doctor knows best, matron knows best. You sit there idle and you're the recipient of care, whereby I think what you're alluding to now is flipping it. You know, the patient knows best. The patient can understand some of the tweaks, some of the nuances that they go through in terms of the day-to-day activities that could be, for example, raising their blood pressure. I remember when every time I had to go see a dentist, for example, digressing, every time I see a dentist, if you were to take my blood pressure when I'm sitting, waiting to go in, and then also when I'm lying down on that chair, you can find it's going to be raised. I'm terrified of it. But before I go to the dentist, my blood pressure is fine. So this is why we're talking about point in time data all the time. Doesn't really make much sense. You need it over a period of time and bringing in data from other activities that actually the patient knows best, because the patient might not have the ability to tell exactly what happened this time last week. You know, in the UK, we have something called, we used to have a program called Crime Watch or Police 50 or something like that. Remember when?
No, it's Crime Watch. Yeah, I remember Crime Watch. Was
there one where they say, keep your eyes peeled? What was that one? Keep your eyes peeled. Watch. Crime Watch. And the guy said, keep your eyes peeled. And it would say, typically there'll be a situation where somebody has had a crime committed or there's been a serious car accident or something like that. And they'll say, if you were at this train station, for example, last Thursday at 9:00, please call this number. Was that Crime Watch?
Yeah.
Wow. Okay.
That was Crime Watch. But you always, I think the problem was, I think they realized was humans can only remember certain amounts of information for a particular amount of time. So you can't ask somebody from a week or two ago and expect that everyone's going to remember. There's only a small amount of people that have that understanding of that information.
Exactly.
Exactly. And I think, so that's why I also advocate, and we spend a lot of time to try and integrate wearable devices, because you want to be able to track the information that's going on with somebody. But it's not because I'm trying to big brother or I'm trying to steal that data. But so me, for example, I can say, I've had so many, I think I'm 11 major surgeries, 5 or 6 maybe minor surgeries in my life. And so when I go in to see my doctor, I'm not giving him what I think, I'm not going to give him 1 or 2 bits of information. I'm running the whole 24, 48 hours before something's happened, post something's happened, and everything. Because I want to give them as much information as possible so they can be informed on that decision. And I'm also going to say, I don't think that could work, or it could be this. But when I go and say with my wife, so for example, growing up, I had an irregular heartbeat, which is still there. Rarely ever notice it, but it's there. So I got blood pressure. I got an ECG machine in the doctor's surgery. I then got it again in hospital. I got given a 24-hour heart monitor. I got given the whole lot. I even had to do a sleep one where they basically monitored me while I was sleeping. And it turns out it's only when I'm completely relaxed and it, like in the middle of the night, at one point in the middle of the night, that they found it. But they had to go through 3 or 4 tests. And each time you go in, no, it happens. I do feel it. It does happen. And for me to keep pushing, and this is 15 years ago, but me keep pushing for it to happen. So if all you're doing is to your example, bringing me in, putting me on a blood pressure cuff, I might be perfectly fine when I come in. So I might come in 2 or 3 times. I come in 2 or 3 times. Each time you do my blood pressure, like, look, it's fine. It's a little bit high, but it's okay. It's within a normal tolerance. I'm going to stop coming in because I'm going to think, I'm just going to go in and waste your time. But also, what does normal tolerance mean? Normal tolerance isn't what's normal for me. Right. So what we've always wanted to do is build a system. So the system takes all that information in the background. So you're not having to physically keep constantly inputting the information, but it starts to learn what's normal for you. So what is your normal blood pressure? What is your normal heart rate? What is your normal amount of steps? What is normal for you? And when that normal changes, how do we look at why that's changed? And if it's changed in a way that we can't infer or find a variable for it, then there is a problem.
Yeah.
You probably know what's the heart rate range is 60 to 90 for an average adult?
Yeah, 80 over 120 is typically normal.
Yeah. But if I know for sure that my heart rate and my wife's is completely different. Yeah. If I get to what my wife's heart rate is, which is hers is also within the normal, I'm feeling very lightheaded. I'm not going to pass out, but I'm feeling very lightheaded and I'm struggling. But if her heart rate gets to mine, she starts thinking there's something wrong.
Yeah, exactly.
So they're both normal. But what's normal for you as an individual? And again, it goes back to, I fundamentally believe individuals need to be a part of their journey, their health journey, and they need to be owning that data. And that data needs to be feeding into a central place. Because that data feeding in, a doctor might go, okay, actually, you know what? This is a little bit strange for you. Why don't you come in and let's check you out? Why don't you come in and let's go? Which means, yes, you might go, oh, this is annoying. But if the doctor's calling you, you go straight in, you see that doctor, you're now being proactive. They've picked up something. If you have, most people have a stroke. Realistically, I know we've done so many TV adverts, but I definitely think if you ask the next 10 people you see, if someone's having a stroke, what does fast mean? I bet you only maybe one of those people that are non-medically trained will be able to tell you what that means.
Yeah.
But why spend so much money on something that people are forgetting and not paying attention because it's not relevant to them, so they're not going to think about it.
Yeah.
When you can very simply have a system that monitors and supports that, and when it sees something wrong. So you have a mini stroke, you're 70% more likely to have a full stroke within 24 hours. So okay, I've noticed there's a mini. Let me call you in. Let me make sure you're okay. Let me check you out. But actually, what I've noticed is the data is meaning there might be a problem. Actually, because of that, I might prep the hospital and tell the hospital, I think someone in the community might be coming in within the next 24 hours of a stroke. So please be aware that that's what happened. And all of a sudden, yes, you might go, oh my gosh, there's a lot of time wasted. No, because you're trying to save that person's life.
Yeah.
And because you're being proactive, the overall cost is going to be a lot lower. And this isn't about saving costs and equating the cost of someone's life. But it's not. What I'm saying is overall you're saving. So if your doctor calls you in and says, these are the things I'm seeing, why don't we quickly change this? Now that's proactive. That's extended your life. That's actually probably saved the time that you're going to be going to a doctor.
Yeah, most definitely.
The hospital knows someone in the community has had a mini heart attack or might have a stroke or heart attack. They now prep that someone's going to be coming in. When you come in, you're not waiting there. They're not trying to work out what's going on. The time that they're spending is ready at that moment in time to deliver the best level of care to you as an individual. Because inevitably, they're not trying to go, oh, who are you? Or what's going on? But also, that might not be your local hospital. So that hospital probably doesn't have all your information. You might be up in Scotland. But because they know you as an individual is there and that information is being shared, they can go, okay, someone in this environment is going to be coming into us. Let's prep for this. And if we're not the right place, let's support them and send them to the right place. So if we're not the right hospital for you to come into because we don't have an A&E, well, we need to tell you, because I know where my nearest A&E is. But if you never go to hospital, you might not know where your nearest one is. You might not know that the nearest one has completely shut down. So right. You're then trying to find it, and it just becomes. We moved to a new house 2 years ago in a different area, and I had to drive around to 3 different hospitals before I worked out which one had an A&E, because in my mind I thought all hospitals that had an ambulance with blue lights going in had an A&E.
Exactly.
For patients.
Exactly. Or
had a walk-in A&E. Didn't realize it was different. But do you know what I mean? And I think that's what it is. So we created, so as I said, we created Care ID, and then we said we need to now start building the consumer. So Care ID was very much aimed at those in adult social care. But we realized that actually there's a massive, a bigger remit that this product can have is those individuals, just everyone. So by giving everyone a secure system where all their data is stored, and they own that, and they can give permission as and when they want to, and they analyze that information. That is what our long-term mission is trying to be. And having that allows you to do remote patient monitoring, allows you to have unified care records, allows that when you're traveling, and this is a big one for us, when you're traveling, your records go with you.
Yeah.
You grant access to somebody in a new environment. That person writes information back into your care records. You come home, your doctor, your medical support team know exactly what has happened to you. You go to a dentist and a doctor don't talk. I get that they don't, they're two different things. But if my dentist gives me Novocaine and I go home and I pass out and bang my head, they're going to go, oh, have you taken any medication? No, I haven't taken any medication. But how do I not know you just had some Novocaine? That might be affecting you. Exactly. You ask people, are you allergic to anything? No, I'm not allergic to anything. Why? I don't know, because if you're healthy and you've never been to a hospital, you don't know what you're allergic to. You don't know if you're allergic to penicillin.
Yeah, it's massive. It's massive. I just want to correct something as well in terms of the blood pressure readings. I should know better as a qualified nurse. Normally, It's the other way around. Normally it's like 120 over 80. I think I've done 80 over 120. That'd be like low blood pressure. Just to put that one out there. And also just wanted to build on what Nicolas was saying in terms of the value and having this data in a timely way, right? For example, the cost, as Nicolas kind of like said already, the cost to the service is reduced because people can prepare for incoming admission. So you don't waste time utilizing the ambulance, going to the wrong environment or wrong ward, doesn't have the right equipment or the wrong professionals, all of that kind of stuff. And he talked about health outcomes. And this is what is key for me. This is where my passion and Nicolas' passion really, really connects, because it's about improving the health outcomes. If people receive the right care, right, in the right time, ultimately the interventions are less evasive. Nicolas was talking about 11 interventions, 11 major operations. Okay, so these things are serious. So if you can then reduce the amount of evasive interventions on the person, they're more likely to have a better health outcome, instead of this revolving doors syndrome whereby people get discharged and within a few days or weeks they're back in. So empowering the patient so that they can see quite clearly the nuances that they can tweak that has a direct effect on their health and well-being. And before we started this conversation, Nicolas was talking about incentives. How can we bring about a situation whereby you can put in incentives into a solution to help people engage better? Do you want to talk a bit about that as well, Nicolas?
Yeah, so it's a system we're working on, and we think we've got the formula down. But what it is, in essence, it's rewarding individuals for living healthier. So it will be creating a digital currency that, depending on how much exercise you do or how much and it's not, everyone that goes to the gym is going to get it. No, it's how you are exercising based on what's normal for you and how you are changing your habits. And by doing that, the system then rewards you with a digital currency, which you can then use in the real world to pay for health services. So you can pay for yoga classes, you can pay for to go swimming, to go to the gym. So it's around leveraging the social prescribing element of it, but finding a way of rewarding people to make them be a part of that journey. So not just, okay, great, here it is, I'll do it, I'll move on. But you're trying to change the mindset and support the change in mindset of the individuals. Sure. So if if you've never gone to the gym before, saying to somebody, go to the gym and work out for an hour, you're missing the factor that might be intimidating for that person. They don't know what they're doing. How much is that going to cost them? But actually, if that individual loves walking, and you might say to the individual, do you know what, why don't you do? Yesterday you did 16,000 steps. Do you know what? You walked 6 kilometers. Why don't you try and do 20,000 steps today, which is actually 10 kilometers, or how that equates to? And that person might go, do you know what? I've just walked 10K. People are talking about running 5K. I just walked 10K. I feel really proud of myself. Yeah. So now that person feels happy. Now that person in a mindset feels a lot more better about themselves. So they're going to maybe want to do a little bit more. So they might go, okay, what I might do is I might join a walking club, or I might join a gym, or, you've now given me this. I might go do a yoga taster session. And I do a taster session. I like it. So now I'm doing yoga more and more, but because I'm doing yoga, I'm also generating health currency, because actually my lifestyle and my mindset, my lifestyle is completely changed. Yesterday I was eating 5,000 calories. Today I'm eating 2,000 calories. I'm not telling you need to cut the calories, but what I'm saying is you're now eating healthier. Yeah. So inevitably you're reducing your chances of diabetes, of coronary heart disease. So all of a sudden now I'm rewarding you for that. I'm not telling you to lose weight. That's not what I'm saying. I'm just saying let's all live a little bit healthier. And because you're part of that journey, you realize that the healthier you eat, the better it is. Wow. And then there's a bit of education around. Yeah. So I personally love chips. I do. I'm a massive fan of chips. Do you like yours done 2 ways? Like you fry it then put it in the oven? I'm a massive foodie and a massive cook. So I will, if I'm at home and I've got the capacity, I normally boil them really, really quick, cold water, ice, leave them for a little bit, and then fry them. in really hot oil, really, really quickly, take them out, put them in the oven, really at high heat, take them out, and then that's it. So it's kind of like that 3 ways. I know people do triple cooked chips and stuff like that. I think that's fine. Mm-hmm. But I just love, because what you do is you get a nice crispy outer shell. You get a nice fluffy.
Yeah, the fluffiness. Yeah, I don't really hear that spoken. Like, it's the fluffiness of the potato. And what potatoes are you typically using for your chips?
Of late, I've been using more spider potatoes because I think they give a nice little. What I like is they're quite knobbly on the outside, so they're not perfect. There's a little bit of crunch, but inside it's nice and fluffy. And if you do it the way we do them, they're lovely. Wow. And also, I basically cook them sometimes if I'm being adventurous in a bit of rosemary oil. So when I'm put them in the oil, you throw a bit of fresh rosemary in there and just let that aroma come through. And,
okay. I'm gonna add that. So what I'm saying there is you kind of take that, something that I love eating, which is oven chips, and you go, okay, if I cook them myself, already I'm stripping out half of the preservatives, I'm stripping out additives, I'm stripping out a lot of the stuff, the crap that comes with them. But also, potatoes are very rich in vitamins and minerals, and they're really good for you. So now, actually, I might be still eating chips, but I'm eating homemade chips. I'm eating a potato that I've just cut from scratch and put in the oven, which is better for me. Yeah.
And actually, now that I'm eating that, because I've taken the time to cook it, and I haven't just banged in the oven, I've taken the time to cut it. I've taken the time to do that process. That is now also meant I've been burning calories, because opening a packet of whatever chips, branded chips or non-branded chips you might have, and put them in a tray and put in the oven is going to take, less than 3 minutes? To cut enough potatoes to make chips, to then go boil the water, to move around your kitchen, however big your kitchen is, to cut those on a mandolin or cut them by hand, that is you're burning calories doing that.
Yeah.
So actually, I'm now somewhat earning those chips. And it's not trying to change big things. You might go, but not everyone has that time. Well, actually, we do. Yeah. We clearly, the last 5 weeks has shown that people do have a lot more time to slow down and do things properly, and do things in a slightly different way. And I think that's kind of, that's what this kind of product is trying to do, is not to try and say to you, let's change, because you can't just tell someone to do a 90-degree turn and expect that it's going to change. I think I was saying to someone that I mentor yesterday, is he said, the way that sometimes you do things, it's not structured. You don't give me an action plan. I go, no, because if I give you an action plan, all you're going to do is tick off that action plan and then come back to me. You're not going to understand why and change your mindset. And I think that's kind of going back to what happened in that interview with Apple, was it wasn't trying to go off a question sheet. It was basically trying to go, I'm trying to change your mindset. So let's make this really informal, because if I ask you questions, you're just going to rattle off the answers based on what you've got on the sheet. But if I try and understand a little bit more about you, I'm understanding your mindset. I'm understanding a lot more about you as an individual. So if you try and understand the individual, learn about their data, you try and change that mindset, but not completely do a 360, you've got the possibility of a long-term, someone adopting that long-term.
Wow.
And by influencing one or two small things, the long-term effect is they're going to understand why they're doing that and what the benefit of that is and how that can affect them as an individual. Wow. And I'm not, look, I know there was a lot of other people that are saying the exact same thing. All I'm saying is we try to do that from a social care perspective. So we have our system is connected up to the likes of Fitbit. We are connected, we're working with Samsung on their S Patch to be able to pull in, I think we're probably one of the only ones in the UK that have it, that are able to pull in a one lead ECG in the community, and that is medical grade approved. So you can connect somebody up and a doctor can see that ECG report in real time, and it gives you every last thing you would normally get, which means you can then say, look, I think you need to come in and actually be connected up properly. Most doctor surgeries don't have ECG machines. I've got people in the community that are connected up to an ECG machine where most doctor surgeries don't have it.
Yeah.
So it's doing these small little things that keep. All we're trying to do is we've built a platform that allows the data to be stored and analyzed, and we're just now building more and more on top of it, and we're just making sure that everyone sees that information. I'm not trying to tell you that you're having a heart attack. I'm trying to say, based on the information right now, there is a change in what's happening and what's normal for you. And that's all I can't tell you it is, because actually it might be, if I say to you, you have a heart attack, you might go, no, I'm just going for a run. Okay, that's a false negative or positive. You do the same thing again. No, I'm just, you know what I mean? I'm doing, I've heard some really horror stories, but I'm doing something else. Then all of a sudden, the next time the system has it, the system goes, oh, they're probably just exercising. All of a sudden, that's when they actually need it. All it's doing is each time it's saying, this is what I've noticed, there's a change. You think it's normal, fine, but I'm just saying there's just a little bit of a change here and there.
You're adding great value within this space, okay? And what I want to just start to close on within this show is, how can people then get access to you? And what's the best way they can reach out to you if they want to find out more?
You know what? I'd always say just email. Just email is the easiest way. I love engaging with people that are like-minded and want to think. I'm happy to jump on a call. I'm happy to meet. Well, can't meet now, but normally happy to meet anybody to talk. I think I don't have all the answers, and I don't think anyone does. But what I think I want to do is to keep speaking to people so we can put something together that helps, because we're lucky to live in a country where we have a national health service. There are so many people around this world that aren't as lucky. And I think what we're trying to create to some extent is giving everyone unified healthcare, is helping everyone to be a part of that health. And actually, by making you understand what's going on, you're saving a lot of money, and the system is actually able to adapt. So imagine being able to, however you anonymize or whatever, being able to understand how a particular condition is working in the community, how a particular medication is working in the community, and being able to plan services around that in real time, but based on the information that's coming out of the community, not information that you can see from a couple of influxes in the hospital.
Yeah, that's valuable, because typically the community sector, that's where you have data blind spots, particularly in care homes, social care, because of the historical imbalance in the use of technology. You know, a lot of money and resources was pumped into the NHS in terms of digitizing some of their processes, but typically we know that's true, because even look at the social care green paper. We've been waiting for that for the last 2 years. It keeps on being kicked down the road. So because you're adding value, you're illuminating a blind spot within the social care environment and unifying it, wrapping it around the whole care instance. I think you guys really, really are adding tremendous amount of value within this space. And we salute you at the Mic Drop Club for all the work that you are doing. And please reach out to Nicolas via email. All his contact details that he wants to share are going to be in the show notes. So look that up, and we will have Nicolas on the show again to break down more technical things regarding his solution and the challenges that his company is helping to overcome within the care industry. So on behalf of the Mic Drop Club, Nicolas, we salute you.
Thanks. Douglas, thanks very much for having me on. I just wanted to, just before I finish, and maybe slice it in however, I just want to talk about my mother, who is you asked why I continue doing this. She's the inspiration. One, because she's getting a lot older in her years, but two, because I want her to keep making her proud. She, over Christmases across the board, and a little bit of an annoyance, Sadiq Khan saying that he wants to shut the train system down. That will destroy care in London, from a community-based care and a hospital-based care, because so many care staff in London leverage transport to get around. They do not have access to their own transport, and they do not live close enough to their home to be able to walk to work. So that's me covering that off. So Christmas for us is a day that the whole train system shut down. So over Christmas, we get 30 plus drivers in. We rent 30 cars and we hire 30 people that give up their Christmas day throughout the day to drive all our staff around. So all our care staff get picked up from their home and dropped off to their relevant service users. We run 100% service, and in some cases, in the last couple of years, we've actually increased where other providers have dropped. What we've done, and that this comes from us, is us, is we've rented a kitchen for the last couple of years, and last year we produced 200 meals for service users that didn't have family members or were able to make a meal, and we gave them all a cultural meal, and they also got some got turkey, some got roast fish, some got Caribbean food, but it was a starter, a main course, and a dessert, and a drink, and a snack given to every last service user. To 200 service users that we that requested one that needed that service, and we've been doing that for the last sort of 4 or 5 years. My mum, at the end of every month, we have a massive company meeting where we go through everything that's happening. We kind of give a look. We do a bit of training. We tell all the stuff what's happening. Most staff come in. She gets up at 3 o'clock in the morning and cooks non-stop until 11 o'clock when everyone comes in and prepares. I'll personally send you a picture, but the amount of food she creates, because she wants everyone to feel welcomed. She wants everyone to feel like she's in it with them. The last couple of weeks, even over the last bank holiday, which was 2 weeks ago, she was in the office working the Friday, the Saturday, the Sunday, the Monday. And I went, "Why are you in the office?" She went, "Well, because my contacts at CTG are working in the hospital. Vassie, Nina, and Louise, they're in hospitals, so I've got to support them, because I want them to know that if they call and someone needs to be discharged from the hospital, even if it's a bank holiday, or if something needs to happen, or they need information, or they need support, they need to know that someone's here with them as well." And that sort of mindset where she's
different breed,
you get this kind of talk of the divide between health and social care, and it's like, well, no, there isn't a divide. Overall, there isn't, because there are providers out there and people out there that all they're saying is, we are working in collaboration together. Okay, if you're there, I'm there. She still does care work. She doesn't need to, and I keep constantly telling her not to, but she does care work. Yeah. She goes. There's a service user she's got that her daughter can't look after at night, but she goes in for 2-3 hours a night and look after her. There was another service user she had that had dementia, that every night relived the Blitz. Yeah. And every night my mom got up, she'd look after this woman. She'd go into the house, she'd put paper on the windows, they'd tape it up, they'd sit underneath, they'd light a candle, and they'd eat a tin of sardines. And the daughter would be there. And the daughter was a doctor, which is strange, but the daughter was like, "Do you know what? No one else would do this." Yeah. Everyone else that we've had that's tried to look after just said they can't do it and walked away. You're the only person that's helping it, and it's not enabling somebody. That's where she feels happiest. You know what? She did that.
Your mother deserves another atomic mic drop for that. Most definitely.
Okay, guys, everybody ready?
Atomic mic drop.
Wow. And I know you can be, there's a lot more that your mother does. And we will put a special mention to her in the show notes as well. And this is why I really get upset when the government, and I'm not trying to politicize this conversation, refers to people as low skilled who work typically within this sector of care. That's the complete opposite. These are highly valuable industries. These should be the protected industries. These are industries whereby you are a true key worker. So saying or labeling somebody as low skilled, where somebody could be in an office and literally typing up notes or photocopying, is something that's white collar and is registered as higher. What has taught us through the coronavirus pandemic is to rethink a whole notion of what we consider as valuable. There are people right now in white collar jobs who've been working from home who are reflecting on the value they actually bring by going through an hour and a half of rat race activities to sit in an office and then do the same 5 days a week. They're actually now thinking, there's no value in what I'm doing. So we need to acknowledge the hard work and dedication of people within the care industries for their dedication, because this goes over and beyond what is in somebody's job description.
Oh, I definitely believe right now, if you look at right now what's happened in a lot of COVID is a terrible, terrible thing. And I don't want to speak on that side of it. What I'm going to speak on is the side that I can see and the side that I know. There are care agencies are still running the full service. And in most cases, they're having to increase. So care agencies haven't dropped. Care workers are still going out into the community at no change. In most cases, and again, I can only speak in London, there's been no uplift in the wage that they are paid, but they are being told to take on positive service users. So you're now putting someone at a risk when everyone else in this country is rolling back. Councils are all working from home. Social workers are working from home. Even we had an OT and a district nurse call us and say, can your care worker go in and do a FaceTime so we can do an assessment on the service user? And you go, oh, it's okay for them to go in. But you've been told that you shouldn't go in because you might get ill, you might get sick, but it's okay for somebody else to go in and do it. And then it's care workers are just going in, and you know what you've seen no grumbles from care workers. You've seen a lot of other people making complaints or being upset about this and the other. But when was the last time you saw a care worker complain about having to do it?
Yeah.
When was the last time they get up, they leave their houses, they go to work, they come home. They know they're putting themselves at risk, but they continue doing it because they have to, because that's what their job is. And they're doing it, and the service level hasn't changed because they're still given the attention. I think what I'm finding from our perspective is hardest is care workers are struggling to be able to keep that distance because you form a bond with that individual. You like to joke around with that individual. That person isn't just a job that you're doing. That person becomes someone that you like, someone you care about, someone that you know intimately. So having to wear a mask, wear gloves, and they wearing a mask, and not being able to see their face, not being able to see their mouth when they speak, it feels so unintimate. It feels, and I get we have to do this to protect everybody, but have a sense of somebody that's built a relationship with somebody and not able to continue that.
Yeah. Yeah.
And I think that mindset is also, they're just going out and continue doing it. Because if you and your partner had to both wear masks, both had to couldn't interact with each other, had to keep a meter apart, whatever, at some point, people are going to crack.
Yeah, exactly. So you're in this space, you're operating within a space whereby you're bringing to bear your unique skills and your passions around technology and embracing that and making it work in an environment that really needs it, because social care is a blind spot, is a black spot, is a blight in terms of data. It's been the poor distant cousin for way too long. So on this platform, we want to promote, we want to push the narrative, get the voice, get these conversations really heard so people can have that rocket fuel driven up their backsides into Parliament so that the Green Paper can come out, targeted resources put into place, extra funding in place, and have conversations with people such as yourself that run companies that understand what that environment needs, what that sector actually requires, opposed to just top down, you shall do this X, Y, and Z. The NHS has wasted way too much money. So they must learn and move forward. So on that note, Nicolas, I salute you. Have a fantastic week, and we shall catch up on the other side.
Thanks, Douglas. It's been amazing.
Cool.
Ladies and gentlemen, Jingles. Thank you for listening. Don't forget to check out micdropclub.com and get the show notes and useful links. Subscribe to the podcast. Don't just live life, make life boom.